Hyderabad. I would now like to invite our dignitaries on the dais. I would like to invite Dr. Ruma Sinha ma'am, senior gynecologist, a robotic and laparoscopic surgeon at Apollo Group of Hospitals and the brain behind this event. She is also the founder president of Association of Gynecologists and Robotic Surgeons of India. I invite Mrs. Divya Devarajan ma'am, Director of Municipal Administration, a 2010 batch IAS officer. She's made a significant impact during her posting in Adilabad, Telangana, amidst the tribal conflict of 2017. She has the honor of a village, Divyagura, named after her. I invite Mrs. Upasana Kamineni Konadella ma'am, founder of Your Life, vice chairperson of CSR at Apollo Hospitals. She is managing director of Family Health Planning Insurance TPA Limited. Ma'am is an inspiration among the aspiring women entrepreneurs and youth icon. She's a guiding force behind Areva, a green skill initiative that works behind an indigenous tribal communities of India. She believes in creating in sustainable businesses rooted in social welfare that creates a deep and long-term impact. Now I'd like to invite Dr. Ratna Devi ma'am. She is Director, Patient Academy for Innovation and Research, Chair at ISPAR Global Patient Council. She's past Chair of Board of International Alliances of Patient Organization. Thank you all for coming and joining us. Now I would like to request Dr. Ruma Sinha ma'am to give an opening remark. Please, ma'am.
Inviting all of us. Andarki namaskaram. Thank you for coming today. Everybody who believes in the cause that we are talking today. It has been 7 years since we have been doing this awareness program along with the Worldwide Endo March Foundation from United States. This time we are lucky. Apart from the Apollo Hospital has always been part of this initiative, but we have two important societies and bodies which have joined this awareness program. One is the PAIR Academy, that is the Patient Advocacy, Innovation and Research. It talks about patients' advocacy, which is so important in a chronic disease like endometriosis. And also the Endometriosis Society of India, which is a national body that works not only to just create awareness of endometriosis, but also to teach, propagate academic research, and to conduct so many seminars. We just had an international Congress of Endometriosis under this aegis in December last year. Endometriosis is being diagnosed more often, not because it's really become a big problem, but because the awareness is increasing. Patients come forward, doctors diagnose it. We want to make this awareness more and more. Sometimes we find there is delay in the point from where the patients have symptoms to the point of diagnosis. Could be because most often it's getting disregarded, saying it's some kind of common pain, let's leave it alone. Or some of the things that very important to understand is these patients can have non-specific symptoms like GI disturbances, and they go from pillar to post from different doctors instead of coming to gynecologists. So I wouldn't take long, just wanted to give an opening remark. I want each one of you today who has joined here with us to be. Thank you so much and thank you for coming. Thank you.
It's by Dr. Sangeeta Reddy ma'am. She's a Joint Managing Director at Apollo Group of Hospitals.
Happy that today all of you are gathered to talk about a very important subject, which is endometriosis. Over 42 million women in India suffer from this condition, and they have various conditions like chronic pain, tiredness, and very often it leads to infertility. One of the unfortunate facts is that most often endometriosis is diagnosed about 6 to 10 years late. If diagnosed early, it can be easily treated and not have any other complications, and most importantly, the woman should not suffer. So today's program is about raising awareness about endometriosis. What are the symptoms? How can it be treated? How can one break away from this? Because today science gives you enough solutions. I want to congratulate the Endometriosis Society for coming together with Apollo Hospitals for doing this awareness program so that women all over the country can realize that they need not suffer, have an early diagnosis, be treated, and therefore lead a completely normal life. Let me also congratulate, besides the society, Dr. Ruma Sinha, who's played a leading role in the treatment of this as one of the most talented robotic surgeons with one of the widest series of treatment methodologies across all gynecological disorders. And I also want to really reach out to women and say that you deserve the very best. You can achieve that by simply reaching out to your doctor if you have chronic pain, chronic tiredness and fatigue, or problems in infertility. Each of these, besides other small symptoms. So if you're just not feeling your very best, don't hesitate to reach out to your doctor. All my best wishes to every single one of you, and wishing you health and happiness. Namaste.
Good evening to one and all. So for the dignitaries on the dais and off the dais, I'm very honored to be here today. It's such an honor to be with Dr. Ruma Sinha. I don't know where she finds the energy to do all of these apart from doing surgeries in the morning and looking at patients in the afternoon, and still finds time for so many conferences like this. But not only she trains a lot of robotic surgeons across the country who are new to this topic, and simply as she put it, it's the awareness which is lacking, and also the effort and the time we give ourselves. I see a lot of young women here who are all working, like all of us on the dais. Whether we are rich or poor, whether we are excelling in the field that we are working, or we are an agriculture laborer or a sanitation worker, we all women put our family first. We put our spouses first. We put our parents first. But we never take care of ourselves. Self-care is always last for women. And we always are told so. That, that this is your role in the society. You need to first take care of others. And if you have pain, that is also natural. You need to bear with pain. But that's such a wrong notion. We need to immediately reach out, and it's the hesitation which also comes in when we do suffer from pain. So I hope you all take home the message that we have an opportunity to reach out, and we should do so. Secondly, there is a lot of problem with access to healthcare for women. So some of us who are fortunate can access healthcare because we are in a city, we are close to a doctor and so on. But many citizens, especially women across the remote corners, may not have access to quality healthcare. So that is something I, as representative of bureaucracy, we need to work really hard to ensure that quality healthcare is at the doorsteps for women even in the remotest parts. And I think that Telangana is definitely doing a lot to take healthcare to the doorsteps of all citizens. So this particular topic is easily diagnosable, easily treatable if the patient comes to the doctors as quickly as possible. So as Ruma Sinha ma'am has told all of us, let us be the ambassadors. Let us convey this message as loudly and as widely as possible so that more and more women get diagnosed and more importantly treated for this issue. And as well as we all take a pledge that every day we should take some time out for ourselves for self-care and also put our health first, because if we are healthy, our entire family is healthy and thereby the entire society is healthy. Thank you so much for this opportunity.
Thank you so much, ma'am. Now we have a short message by Dr. Carmen Mehzad. He's a professor at Stanford Health, San Francisco, USA. He's a director center for minimally invasive and robotic surgery. He's founder of Mehzad Foundation for Endometriosis and Worldwide Initiative for Endomarch. And he is...
Hello, greetings from California, USA, to my esteemed colleagues, patients, and viewers, to Apollo Hospital and Dr. Ruma Sina in Hyderabad. As I address you today, I am profoundly honored to speak to a community of you that has shown your unwavering commitment to the cause of endometriosis awareness and advocacy. Over the past decade, the Worldwide Endo March has evolved into a powerful force. You have been part of it, transcending borders and bringing us together in a shared mission. As yet, we have tirelessly advocated for those with endometriosis, and a glaring reality has become apparent: the lack of endometriosis specialists around the world to treat patients in need. You are very lucky that you have in Hyderabad, you have been one of the original founders, that you have been part of the Endo March, and with Dr. Ruma Sina and Apollo Hospital have been taking care of the patient with endometriosis. However, in response to this urgent need, we have founded the American and Global Congress of Endometriosis Subspecialists. Our goal is to train future generation of healthcare professionals, ensuring that individuals with endometriosis receive the specialized care they deserve. I congratulate you in Hyderabad, in your wonderful city, with Dr. Ruma Sina, and in Apollo Hospital, because you have been one of the founding members of the Worldwide Endo March, and in your beautiful city, in the Hotel of Falakname. I have been there for a meeting before, and reflecting on these 10 years of the Worldwide Endo March and the launch of the Congress, I am struck by the incredible strides we have made in raising awareness and fostering collaboration among healthcare professionals, researchers, and advocates, with patients involved in every step of the way. We are not just raising awareness, we are actively addressing the shortage of specialists and training providers, and hopefully other educational entities will devote more attention to endometriosis care, research, and training. As we look ahead, the mission remains crystal clear: to continue pushing boundaries, challenging norms, and driving advancements in the understanding and treatment of endometriosis. From my vantage point, I see a future where the silent suffering of individuals with endometriosis is acknowledged, understood, and met with effective solutions. Our collective vision is one where early detection is the norm, where treatment options are not limited, and where the stigma surrounding endometriosis is dismantled. It's a future where the Worldwide Endo March and Access serve not only as platform for awareness, but as catalysts for tangible change in the lives of those affected. I am inspired by the dedication of each and every one of you, and I am confident that Endo March will continue to be a driving force in the global fight against endometriosis. Together, from California to Hyderabad and Apollo Hospital and around the world, we persist in our efforts to make a difference. Thank you for your commitment, your passion, and your tireless advocacy. Enjoy your time in Hyderabad, and forward we go.
Thank you for the note, sir. Now I would request Mrs. Upasana Kamnani Konadilla ma'am to address the gathering. Please, ma'am.
Thank you so much for calling me this evening. I have so much to talk about women's health, but thank you, Dr. Ruma, for bringing me here today. It means so much to me. And endometriosis, you all know that 42 million women in India are suffering with endometriosis right now. I mean, who would have thought so? And if we can do, this is just one of the women's health issues. While I'm wearing yellow for Endo March and endometriosis today, I want to take this opportunity to talk about women's health, because I think it's really, really important for us to make us a focus. I want to ask all of you and myself this question. Is it wrong for me to make my health a priority? Is it wrong for me to take the day off and take my family members and go and visit the doctor? Is it wrong for me to make my health and my wants a priority? Is it wrong for me to have a baby when I want at my choice? So these are things that I want all of you to ask yourselves. And with rock stars like Dr. Ruma today, I think you can have a baby whenever you want. Thank you for delivering me and my sister. So I think that, when you know you are ready and you take charge of your health, the whole world opens up for you. I only want to take this opportunity to tell all the women out there, your pain matters. Your pain matters for you. Your pain matters to your family. Your pain matters for the country. Because if you are sick, you do not know how badly it affects the country. Please take care of your health. We form more than 50% of the population of India today. It's our right to be healthy. It's our right to be happy. All that power is in your hands. Do not let health issues bring you down, because there are rock stars, many like Dr. Ruma Sinha and other healthcare professionals out there who are there to help you. Thank you.
Society India, this program under the aegis of ESI and in collaboration with Apollo Hospital, Hyderabad. As you know, she has been working as a very senior gynecologist with special interest in robotic surgery in that institution. Now, endometriosis is often a severe chronic disease affecting around 1 in 10 in the reproductive age group worldwide. The incidence is rising ever since, and that is why we are worried. It is estimated that 30 million women in India are having this disease out of 200 million women in the whole world. Now, this disease can have devastating effects on women, both physical and emotional well-being, quality of life, and reproductive health. Consequently, those affected often develop mental health problems and may suffer from depression or anxiety, accompanying feeling of frustration, loneliness, and even shame, leading to a complex multimorbidities. Across the globe, March has been declared as a awareness month to increase education and to allow early diagnosis, eliminate stigma surrounding this often misunderstood condition. I feel it is important to spread this awareness program through every month of the year, rather than restricting to 1 month of March. Now, lack of awareness of endometriosis, both patient and healthcare providers, often lead to an underdiagnosis and prevent timely treatment of this condition, which has significant social, public health, and economic implication and impaired quality of life. Many people, including healthcare providers, may dismiss the symptoms of endometriosis as normal menstrual pain, leading to a delay in diagnosis and treatment.